Good day everyone, I'm David, the moderator for this webinar. I welcome everyone for today's webinar, which is Navigating the 2024 Medicare Physician Fee Schedule Final Rule Updates. I would now like to introduce our presenter for today, Tony L. Holmes. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved ICD-10 CMPCS trainer, is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She holds multiple credentials with the American Health Information Management Association, AHIMA, and the American Academy of Professional Coders, AAPC. I would now like to hand over the floor to the speaker. Over to you, Tony.
Thank you so much for that warm introduction, and thank you to all of our attendees today. We're going to be talking about the upcoming 2024 MPFS Final Rule updates. MPFS stands for Medicare Physician Fee Schedule. So today we're going to be talking specifically about the key updates for the 2024 MPFS Final Rule. We're going to talk about the financial impacts. We're going to talk about the conversion factor, what's going on with the Medicare Economic Index, the MEI, and I have to tell you it's not looking good. So we're going to be talking about some strategies that you can incorporate within your organization to help offset some of the reductions that are coming starting on January 1st. We're also going to be talking about the impacts of the 2024 evaluation and management updates. So there is a new G code. We're going to be talking about that G code. There have also been some updates to the time thresholds for office and outpatient services. So we're going to talk about that because it greatly impacts the big picture of the MPFS cuts and how, the focus has always been on budget neutrality, but we've got this new G code and we've got to figure out what documentation is needed to support billing for this service, because Medicare is saying 38% of encounters should be reported with this new G code. So we're going to talk about that. We're going to talk about what the financial impacts look like for E&M services, and then we're going to talk about some of the major changes that came about for remote care services like remote patient monitoring, remote therapeutic monitoring. We're also going to talk about the telehealth rules that were incorporated into the MPFS Final Rule for 2024. Now, everybody's talking about this G2211 code. So kind of a background on this code. This code was moonlighted, I believe, in 2020. Some other updates are the appropriate use criteria program. Another really major change that's going to impact behavioral health, mental health professionals is Medicare is going to allow clinical social workers, licensed marriage family therapists, and mental health counselors to enroll in Medicare. We also have some updates for telehealth services. We also have some pretty significant updates for split shared services, for evaluation and management services. So the big change here, obviously we have the payment reductions, but we also have the standardization of time threshold. We also have some new HCPCS codes, so some G codes. So we have principal illness navigation codes, or PIN codes, G0023, G0024. We also have a new assessment code for the social determinants of health. So G0136 is for administration of a standardized evidence-based SDOH risk assessment tool. We also have some new codes for a caregiver training services, so CTS. So we've got 97550, 97551, 97552. So let's talk a little bit about the financial impact for your evaluation and management services. 99214 is our next E&M code, also a pretty commonly reported code. So now let's talk a bit about the changes in the MPFS specific to remote care services. So we have remote patient monitoring, we have remote therapeutic monitoring. We got some pretty big clarifications and updates within these services in the 2024 MPFS Final Rule. With our RTM codes, remote therapeutic monitoring, these are basically monitoring therapy adherence or medication adherence, medication compliance, pain levels, things that are not biometric data points. That's pretty much it in a nutshell. You want to make sure that you're auditing internally, externally, and you're doing it as frequently as possible. I would recommend at least monthly, if not quarterly at minimum. Thank you so much for your time and attention today. I hope that this webinar has been valuable to you. Thank you so much for your time and attention, and I hope you have a great rest of your day.
Thank you, Tony. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now and have a great day.